I knew that I wanted to be a surgeon when I was in probably sometime in high school. And then medical school just kind of reinforced my passion. During my formative years in residency, I would say that I felt that my niche was going to be cancer patients. When they are referred to my office, they already know their diagnosis, even if it's like as small as an anal fissure, a hemorrhoid, or as big as I have rectal cancer. So they're usually walking into my clinic with some sort of idea of what this diagnosis is. And so a lot of my preoperative visits are very nervous and anxious people discussing something that's very private and with not a lot of knowledge about it. My visits go like 5 minutes of just kind of me trying to gather what they know and what they've been dealing with. And a majority of it deals with counseling and educating these patients, even if it's, like I said, a small benign disease process such as a hemorrhoid, or discussing what their cancer surgery is going to look like. I see rectal cancer especially, these patients are my patients in my office starting at the first day of their diagnosis to nearly at least a year that it takes them as they're going through their chemo radiation. We do form a bond with these patients. These are such hard problems to open up to. And when patients open up to you and trust you that they can tell you frankly what they're dealing with, and then be accepting of somebody operating on them and forming that trust. And after that, when you deliver and they have good outcomes, that the satisfaction that they have with you and your care and your team's care, that's the most rewarding part.